So today I have an interesting kind of thing we're going to talk about. Um, when you sign up for the newsletter, Sex After Retirement, and you can sign up at sexafterretirement.com. Um, One of the things we do in our emails as we welcome you is we send you a questionnaire, a bit of a survey. We want to get to know who is reading our newsletter. And we also want to know kind of what has worked, what hasn't worked, what questions we can answer, and maybe sort of that ideal scenario about what you're looking for. And so one of the questions that we ask, and I'm going to be looking at my notes today, but one of the questions that we ask people is what questions about sex in retirement or just in your phase of life, you don't have to be retired, but in retirement, do you still need answers to? So what questions about sex do you still need answers to? And the reason we ask this question is because I talk about sexual activity all the time, and kind of my mind is moving at the pace where my mind is. But sometimes I don't actually know where you are. And so for me to write a better newsletter, for me to give you better information, it helps to know what questions you have. And so what I've done is I've gone through and we've got hundreds of responses, and I want to thank everybody for those responses. But I've gone through and I picked 10 today. And I want to go through them because I think that they really highlight and capture a lot of the breadth of what people are wondering. Um, it's clear to me that readers feel very distressed about their erectile dysfunction and they are searching for a solution, or they're distressed about their situation and they're searching to understand it. They're not even ready for a solution, but they're searching to understand it. And it's clear also that best case scenario for a lot of men is restoring what they've lost, getting back to normal. And then the fear that is associated with the aging and the march of time, and the fear that things are getting worse, and the fear that at some point they may end. But then there's also this sense of, let me know where I am, this acceptance, or this, now that I'm here, how do I move forward? And then just how intimacy can look different, even if we don't go back. And so I'm going to start. As I said, I'm going to be looking at my notes as we go through this. Um, but I want you to listen to the questions, and I want you to feel sort of how vulnerable these men were. Men aren't vulnerable, but vulnerable in sharing this important part of themselves. Because I think one of these questions is going to have something that rings with you, and maybe all of them. And so let's start with the first one. The first comment, and I will say that while we asked the question, what the comments were very candid. And so the first is, I'm at a loss in this department. I will keep searching for solutions. I think that this is so many men. And I think that this is how maybe you found the newsletter. Meaning, this guy, let's call him Dave, has been looking over and over and over for solutions. Um, and the way that he has sort of coped with the loss of his erectile dysfunction is searching. That, men are doers. And if men are doing and producing and looking to solve a problem, then we are managing. And managing feels for us a little more acceptable than the doing nothing or the watch and wait. And so we get with the doing. We are online, we're searching, we're reading the emails, the texts from our best friend Joe. I always say Joe's a nice guy, but Joe might not actually be a urologist. And so ultimately what that does in the short term is it scratches the itch, but the cause of the itch is not completely relieved. And ultimately what I hear in this is that he is tired. He's tired of looking for solutions or solutions that he's tried and not working. And so I want people to know this. Um, Searching serves a role, and I always want people to be informed and I want people to have good information. It's why I write the newsletter. But it's also okay to stop, to say that this thing I did, this searching frantically online after midnight, ordering the pills, the supplements, eating the beets and fasting and all of that. It's okay to stop doing that and trying to fix this on your own. And maybe the next step is to ask better questions or to ask those questions to somebody who might actually have some solutions. And so part of this is that you've identified a set of solutions, but maybe that's not all the solutions. And so it's important also to understand that the industry around supplements and around optimization have trained you to find the answer online. But there's a transaction always going on there. If you just do this and pay this money, you'll get this result. And they're selling you the result, but the result's not available to everybody. So when you're tired of not getting the result, my recommendation is a better conversation. And you've heard me say this before, is a better conversation with a urologist, somebody maybe not a urologist, but who has a special interest in your well-being and in getting a solution for you. So that could be your primary care doctor. It could be a naturopath, but an interest in sexual men's health. Um, Being at a loss after a genuine effort to find a solution, that's not failure. It's really just the signal that the next step has to be different. The stop, take inventory and say, got it. That's not working. And as men, what do? We find another way to find a better solution. And I think for this guy, that solution needs to be a better conversation about what options are actually available, not just in the form of a supplement or something that he buys online. Here's the second comment. Dealing with the frustration and how to get my sex life back together. I don't have to tell you, because you live it, that the frustration is real. It's real for so many reasons. And I want you to just know that it's okay to be frustrated, that sex isn't the same as it used to be. What I observe is this: when men notice a change in their erections, they don't experience it as something that is purely technical, meaning functional, that the machine isn't working, that the car just stopped and wouldn't start. What they experience it is as a verdict on who they are, their value as a partner, their value as a man. And that's a deeper cut. How would that frustration feel as we try to get their sex life back together if we framed it more as a problem of function? Not the guy driving the car. It didn't stall because the guy driving the car was a bad driver. Although if he doesn't know how to drive a stick, maybe he popped the clutch and it stalled. But just in general, the guy running the machine isn't the problem when the machine is broken. And that's what we mean when we say there's loss of function, where the physiology, the function of the body has changed. And when we focus on trying to improve the machine, that's a different frame, because that's not really about who you are and who you are in your relationship. That's just about what has happened over the 50, 60, 70 years that that machine, your body, has carried you to today. And when we focus on the getting it back to before, we don't buy a vintage car so that it's exactly like it was coming off the lot. But we say, what can we do with it now? And how do we move forward? I often think about this, to say, there's the car and the machine. And when we're talking about the moving forward, it's like, well, what are the tools that we need to move forward? Think about a game of golf. You used to golf without a cart, and we called that golfing. But now, instead of walking the whole course, you use a golf cart. And you know what? We still call that walking. We still call that golfing, but you didn't do all the walking. But you were out golfing with your buddies. And so we can golf without a cart, or we can golf with a cart. We can have sex without help. But if the body isn't working the same, sometimes we need some help. So we can have sex with help too. And so it's really about meeting what your body needs with what treatments are available. The next comment was, I want the perfect solution for my ED problem. And I think that this is interesting. First, I know that when you're reading a newsletter, the newsletter is written for many people, not just for you. And I think the important thing that he is highlighting here, and it's really one of the things that I try to accomplish with the newsletter, is he understands that every person is different. And I think that I want you to understand that also. And so I'm trying to give you context. I try to not just say, here's ED and here's a list of all the problems, because none of them may apply to you, or only two of them apply to you. And when two of them apply to you versus none of them applying to you, the solutions may be different. So context matters. And again, that's always why it's important to have these discussions, not just online with your Google search, but discussions with an expert who can actually help you. The second piece I want to add here is, there is no perfect solution. And I hate to be the one to tell you that, but the perfect solution is not there. And if we're looking for it, no solution is ever going to meet our expectation. We always say that, the ideal treatment, the perfect treatment for erectile dysfunction, should be spontaneous, reliable, should last long enough for intercourse, and the erection should go away when we're done with no side effects. Because that's how erections, when you were 25, happened. On demand, as long as you need them, when you need them. When you're done, it was gone and you carried on. But when we're older, what we're talking about is trade-offs, right? Someone else's physiology is different. Someone else's priority is different. So somebody wants a really hard erection, or somebody just needs a reliable partial erection. Somebody who is maybe dating wants spontaneity more than they want to use an injection. And so we really have to address the needs of the man and his partner and the sexual activity that they have with the physiology. Like, a guy after prostate surgery whose nerves have been removed is different than the 55 or 60-year-old who's had a little bit of high blood pressure and cholesterol, and now his erections aren't as good. They're going to be looking for different needs based on their physiology, because the guy who's had his prostate removed isn't going to respond, prostate removed with nerves removed, isn't going to respond to pills in the same way as the guy with some mild ED because of blood pressure. And so context matters. And within the context, we can identify, priorities understand the physiology, and then start really looking at where we can meet you with finding a solution. The next comment is something that I hear all the time, and it is, I want it to be like before retirement. And so they want me to have been in the sex before retirement newsletter business to say what's happening and how do I prevent that. Again, I have to be the bad guy to say it's not going to be like retirement. Even very healthy before retirement, even very healthy guys who've done all the right things, all the physical activity, they've managed their stress, they live a healthy lifestyle, experience the march of life. And if we don't acknowledge that things may not be the same, we may never be 25 again. We're going to be stuck in this nothing works. And so in the nothing works space, I think we sometimes, get in our own way. And what's happening is that there are things that are helping, that are making an improvement. But if the benchmark is age 25, it's always going to fall short. And so it's really understanding what's been lost. For some men, they're still getting erections, but they're less spontaneous. Um, and and for some men, the treatment that they're using or the need to use a treatment that is less reliable affects that spontaneity. And so we have to get past this idea that the container where the old self lived is achievable. And I understand that there's a grief with that. There is a redefining of who you are, because as I've already mentioned, we want to show up in a certain way in our partnership and in our sexual relationship. And so what we have to be able to do is um, identify what has changed. And just like the last question, is it spontaneity? Is it change in interest? What is happening in that couple? Um, and working in that space to figure out what the relationship needs. And again, it's really just how are we using the toolbox better? Um, and so I just want to acknowledge the grief that comes with knowing that this may never be exactly like it was before retirement when you were 25, when you didn't have to use a pill, a shot, a vacuum device, an implant. And I understand that grief. And I want you to understand that getting help is still possible. And, that starts with an acceptance that there's a solution, albeit different than what it was. The next comment was short, and it really is a question about, can we put the brakes on, or a comment about putting the brakes on. And it was simply reversing ED. How do I reverse erectile dysfunction? And I think the honest answer here is it depends. It depends on what is actually causing the erectile dysfunction. You've heard me say a lot of times the march of life, and that's kind of a catch-all phrase that I use a lot to say that it's complicated. Getting an erection is complicated, and it requires many systems to be working all at once. We have to be in the mood, libido. We need neurologic signaling. So neurologically, the nerves have to fire uh, and get that information to the penis, which is a vascular structure. And then those blood vessels have to respond by opening up and letting blood flow in. And then the structure of the penis has to allow that blood flow to seal that blood in, allowing the erection to go from full to hard. All of these things are then affected by previous surgeries, our hormones, our testosterone, sleep, medications, level of activity, level of stress, and the list goes on. And so we're always dealing with this scale. And I think what invariably happens is sometimes we focus on the one thing, the last thing that changed that tipped the scale, when in fact there were 3 or 4 other things. And so that person, let's say, who has been seeing a mild decline in their erectile dysfunction, who then, has a lot of stress related to something. The stress could be that, but that thing that tipped the scale into this is no longer working. But we have to also understand that this process was already happening. And so are there ways that we can A, manage the stress, but B, improve the vascular erectile dysfunction? I wrote an article early on when we first started about walking and weight loss, and that consistent aerobic exercise a few times a week for 30 to 40 minutes showed a statistically significant improvement in erectile function scores, the testing score that we do to quantify how severe, mild, or moderate someone's erectile dysfunction is, in a noticeable way. And what we noticed in that study, and it was what's called a meta-analysis, so it looked at lots of smaller studies, looked at the quality and then put them all together, and pooling that data came out with the fact that the guys who had worse ED actually benefit more from exercise than the guys who had mild to moderate ED. And so in terms of the reversing ED, exercise is one of those things. Stress management is one of those things. Better sleep is one of those things, because sleep then affects our body's repair. And when our body is not rested, it affects our hormones. And some men will experience declines in their testosterone because of poor sleep. And so if you're thinking that you want to reverse this, and maybe testosterone's part of it, but you have sleep apnea and you're not sleeping well, we know that 1 week of poor sleep can drop your testosterone by like 10 points. And so I meant 100 points. And so what I'm trying to say here is that there are these things, these ways that if we stack them up on the other side of the scale, can we tip things into maybe improving erections, or at least slowing that march of life? We can't fix the damage that happens when you remove the nerves at surgery, or the accumulated damage of radiation on the nerves that supply erections. And even when we do all of these things, even when we optimize, this march of life still happens. But really, it's about getting serious with what you're doing at home, but not always just getting stuck with what you're doing at home, also using the help of a sexual health expert to really optimize and charge that system of making changes at home. And I will make a pitch here just for one treatment. It's called shockwave therapy. Shockwave therapy in men with mild erectile dysfunction does have the ability to potentially stop and maybe reverse some of that age-related accumulation, hardening of the arteries, which makes erectile dysfunction happen. And so for men with age-related progressive erectile dysfunction related to vascular disease, high blood pressure, diabetes, high cholesterol, there may actually be some improvement with shockwave therapy, but not in everybody. And I think an important part of the discussion about shockwave therapy is how severe the erections are, and then what are the outcomes we can expect. And that's a whole other topic, but I do have an article about shockwave if you'd like to read it. The next was interesting, and it sort of segues to this optimization. His comment was, I want to know if it's my high blood pressure medicine or the statins that are causing the problem, because and whether the stomach acid pill, which is hindering the uptake of vitamin B12, could lead to ED, because I've had an issue with B12 deficiency before, and that caused some nerve stuff. And I think that this is a very sophisticated comment. This person's been doing their research, and I want to break it down and be careful. The most important thing I want to say here is don't stop the medicines today because you think they might be causing a problem, because stopping might actually make it worse. And so so what I have already mentioned in this video is that this scale sometimes is just teetering. And maybe in this guy, he started his blood pressure med and boom, he now has erectile dysfunction. That same blood pressure med in a 25-year-old may not cause ED because that system wasn't teetering. You know, that system was here and you put that blood pressure med and it's only there. But in that guy who's teetering, one more, little push on that scale puts him into that space of erectile dysfunction. And so it could be the blood pressure medicine, but it could also be the blood pressure. And so this is why it's important not to stop. There are some blood pressure medicines that are more implicated in erectile dysfunction. And without going through the list, I want you to talk to your primary doc to say, is this med causing it? But I also want you to know that stopping it and letting the blood pressure creep up could actually accelerate and put gas on the whole underlying process making your erections worse. The second piece is about the statin drugs, and the data is mixed because historically there was a thought that maybe it was making ED worse. But more recent analysis of this same topic has showed that statins, which control or help to control cholesterol, may actually be helpful in the long run by preventing the ED because they prevent the vascular disease, which leads to the ED. And so the statin piece is to be determined, but we're evolving to think that they may actually be helpful in the prevention of worsening ED. And then the issue about the acid blocker, a group of medicines called proton pump inhibitor, is interesting, because they can impair B12 uptake. And what I would say is this: we can test for B12, and so having that done is probably the starting point, rather than making this assumption from A to B to C. If the B12 is normal, this is not the cause. But I would say that this person's described that they had issues before, and so it's probably worth pursuing. I think the highlighted point here, though, is that this guy's actually doing what he should be doing, asking questions. He is looking at his life, and I hope he's looking at his nutrition. I hope he's looking at his sleep, his level of physical activity. He's looking at stresses in his life and in his relationship. He's not smoking and doing the things to optimize and saying, is there a weakness in the system here? We don't have to be perfect, but we just have to make a small change and then test it. And then test another one and test another one. And if we layer things, maybe we can prevent things from tipping into a problem and keep things stable, or maybe even improve. But I don't want people to take their pharmacy into their own hands. I want them to have discussions with the person who prescribed the medication so that you can actually have a risk versus benefit. And sometimes it's as simple as finding an alternative medicine to solve the same problem, especially if it's like blood pressure. It's from one class that is known to cause more issues with ED to another class that is not likely to cause ED. That's a win. It manages your blood pressure and you get to see if it helped your erections. I like this next comment, and it says, I think you've answered a lot already. I just need to know that it's not the same as earlier in life. I can't tell you how many times I've heard men say that, or I have said that to someone, and there's almost this sense of relief that, we talked about it already. We talked about, I want things back to how they were before retirement. And a lot of people feel grief when I say it's not getting there. But there's a lot of people, instead of grief, who feel relief, because it's almost a permission to say, okay, I can stop chasing something else. Um, and I can now sort of focus on what's happening right now. And it doesn't have to be like that. And that's okay. And that's okay for that man. And that's okay in his relationship. Um, and I think what this really does is it gives people permission to say, what can I do now? Because at this stage of life, success isn't necessary for some men, isn't necessarily a spontaneous, hard, reliable erection that allows him to repeat sexual activity over and over again. For some men, it's actually the permission to stop pursuing sexual activity. For other men, it is to say, okay, well, now I can look at my relationship and say, my partner has, terrible dryness and discomfort with intercourse and isn't that interested anymore. But when we're intimate and close and, the foreplay is enough. And it's still a vehicle for them to express desire, express, a closeness through intimacy without intercourse. And so it's really about taking an honest look at what your body is capable of, what you're willing to do, what your partner is open to explore, and how we continue to show up, as loving, intimate partners in our relationships. Um, and so, I think that this is I think it's a really nice kind of realization that knowing that it's not the same as earlier in life, and that's okay. I think that's really powerful, and I still remember telling someone who was mid or late 70s that it's okay to stop trying to fix this problem, and tears ran down his face. And after a couple moments, he apologized and he said, thank you. And for him, that was the solution. And so just knowing where we are, accepting that, and letting that be the truth is also okay. The next topic or comment was, well, I'm 73 and I want to know how much time I have left. Or is it all of a sudden going to die? Is a cliff coming? This is an honest fear that lots of men have. And men know, as they've worked through the progression of low dose, sometimes I take Viagra, to higher doses and maybe even injections, that they might be on borrowed time, or that they feel like they're on the off ramp, and eventually it's going to drop off. The bridge is going to collapse and they're going to drop off. And it's uncommon for things to end suddenly, but they will change gradually. And I think at 73, sort of the important thing here is what's driving the current situation. We've spent a lot of time talking about blood pressure and optimization, and it's really about asking questions. Just like the guy who had the questions about the meds, like, what's driving the situation here, and is there room for me to improve? Um, and it may be improving, but it may also be getting the understanding that the tools that have or have not worked are just part of the whole solution. And maybe for this guy, a discussion about a penile implant, and what a penile implant can do in terms of restoration. I did a video about a patient who at 81 said his recent penile implant operation made his and his wife's sex life and their day-to-day life better in many ways, and that they had never been closer, that he was no longer depressed anymore. And so for him, he had already fallen off that cliff and acknowledged and faced the fear of a harder solution, a penile implant. And fortunately, he was healthy enough for sexual activity and for an elective operation. And the gift that operation, and he said to me, even if I only live 2 or 3 years, these are going to be the best 2 or 3 years of the rest of my life. And so that's why it's one of the reasons I love doing this type of work. But B, it's also to say that you can fall off the cliff and there are still solutions. And so some people have to work through all of them so they don't regret. Um, some people, as the last comment was, have to say that it's okay to stop, hear that it's okay to stop. And for some people, it's actually not too late. But spending time with random online solutions, supplements, and quick before and afters may not be the best use of your time. And spending time with an expert or a urologist who does prosthetics, if that's what you need, is probably a better use of your time. The next comment was, how do we get rid of ED for good? And I'm going to be honest, and I've covered lots of these already. ED is just a natural stage of life. 50% of men in their 50s experience it, 60 in their 60s, 70 in their 70s, 80 in their 80s. And so the march of life is real, and every 10 years, 10% more of us have it. And so, as I've said before, focusing on exercise, sleep, stress management, our vascular health, all of those things that keep our heart healthy are going to help keep our penis healthy. The penis is the canary in the coal mine. When erectile dysfunction happens, in most people, it is a sign of an underlying vascular condition. And so let early ED be the warning to do better. But in spite of best efforts, we can only slow that train so much. And just sort of admit it's happening. That doesn't mean we admit it and let it happen, and meet the moment with the right treatment for where the severity is and where our relationship is and what our goals are for treatment. Another question was how to get sexual gratification without an erection. This guy, I think, is confronted with or experiencing severe ED. Maybe he's tried a lot of treatments and they just haven't been helpful. And so he's saying, how can I do this? I maybe don't need to have a hard penis for this to happen, but I want to orgasm. Orgasm for some people is the most important part. And simply hearing that you can stimulate the soft, flaccid, floppy penis and still achieve climax, for some people, that just opens their mind to possibility. For other people, it's also that same acknowledgement that intimacy can happen in other ways. And so maybe this is an opportunity for experimentation. I wrote a piece about, different toys that are available for men, different ways to stimulate the body. And for other people, it's really just about acknowledging that sexual activity doesn't actually have to be about intercourse. So much of treatment of ED is about improving the mechanics, getting the penis harder so that intercourse can happen. And for couples where intercourse isn't part of it, maybe they don't need that. And so again, this is about meeting the moment. And it's also about sort of understanding what the partner needs. For a lot of couples, especially aging couples where menopause is an issue, sex is uncomfortable. And so for a lot of couples, the relief to say that we can be intimate without intercourse actually brings them closer together. Because if sex was painful for his partner, but his partner was still engaged in them having a sexual relationship, it may have been that there became a duty, and then that duty created distance, and that showed up as lack of interest or no sexual activity. And when we all of a sudden shift to say, oh, we can be intimate without intercourse, and then it's no longer painful for his partner, there may be renewed interest. And so we get lots of comments also about my partner's not interested. Sometimes we have to get curious about why are they not interested. It's not always a verdict on you as a partner. It's not always that they're not interested in you. It might be that they're not interested in having pain with sexual activity. And so this is important. And it's really about communication. I was given a book in med school, and I wrote an article called Sex is a 13-letter word, communication. And so communication with the partner, but also asking the right questions, not how do I fix the erection, but how can I still have fulfilling intimacy that doesn't require me to have a prescription, a needle, an operation, or use a vacuum pump. And so that's all 10 of them. And I know that took a few minutes, and I suspect you probably heard yourself in one, two, or many of those. And so I want you to keep replying with your thoughts, and I'd love for you to comment on what maybe sat with you, what you agree with, what you disagree with, or what other questions you have that I could answer. I love keeping you as best informed as I can, but I do better when I know what I haven't talked about already. Thank you for being here as always. Have a good rest of the day.